Further shows the subcellular changes that are happening in terms of the pathogenesis and the pathological pathways on the subcellular level in the osteoarthritis. So it's the inflammation, again the same old chronic low-grade inflammation, and the cellular senescent associated phenotype, very important hallmark overall of all age-related chronic degenerative conditions: mitochondrial dysfunction, oxidative stress, dysfunction in energy metabolism, again due to down-regulated AMPK gene, reduced autophagy, alterations in cell signaling, age-related changes in extracellular matrix, and that all leads to further development of osteoarthritis by promoting pro-inflammatory catabolic state accompanied by increased susceptibility to apoptosis that altogether leads to increased joint tissue destruction and defective repair of damaged extracellular matrix. On the right side of it, you can see the slide a bit elaborates on how exactly that's happening. It's a downregulation of the superoxide dismutase 2, which is a very important mitochondrial antioxidative enzyme, increased hyperoxidation, further contributes to the reduction of the mitochondrial biogenesis, impairment of the mitochondrial DNA, reduction in the mitochondrial number and the size, the mitochondrial mass, increase of oxidative stress, reduced antioxidative levels, and then downregulation of the AMPK, downregulation of the IGF-1 signaling, and increased protein thiol peroxidation or oxidation. All ends up with the increased chondrocyte death and loss of matrix of cartilage. We're going to talk about the conventional medicinal products that are used for treatment of osteoarthritis. And you can see the table in front of you together with the name of the agents, the proposed or known mechanism of action, and what is the evidence is behind it. Well, let's elaborate a bit about it. Endogenous, or in other words, naturally occurring hyaluronan, known as hyaluronic acid, or previously well known as a hyaluronic acid. Well, it's a large linear glycosaminoglycan, is a major non-structural component of both the synovial and cartilage extracellular matrix. It is also found in synovial fluid and is produced by the lining layer cells of the joint. Key function of the hyaluronan is in the joint are the lubrication and the maintenance of tissue hydration and protein homeostasis through the prevention of large fluid movements by functioning as an osmotic buffer. Hyaluronic acid is also considered a physiological factor in atrophic status of cartilage. Research evidence on the efficacy of the hyaluronic acid is often difficult to interpret because of confounders, including different molecular weights, different injection schedules and protocols, and despite large number of studies, generally poor trial design. It's a lack of intention to treat analysis and limitations in blinding of the study. Intra-articular hyaluronic acid injections for osteoarthritic knee was actually rejected by the United Kingdom National Institute of Health and Clinical Excellence. It's a national collaborating center for chronic conditions and osteoarthritis. And there were specific UK national clinical guidelines for care and management in adults released in the year 2008 in London by the Royal College of Physicians. Moreover, a recent systematic review and meta-analysis has concluded that from baseline to week 4, intra-articular corticosteroids appear to be relatively more effective for pain than intra-articular hyaluronic acid. By week 4, after 1 month, both therapies